Seasonal Affective Disorder is a type of depression that follows a predictable pattern based on the seasons. It's not just feeling a little gloomy on a rainy day. SAD is actually classified as a major depressive disorder with a seasonal pattern. This means it meets the same criteria as clinical depression, but it comes and goes with the changing seasons. Most people with SAD experience symptoms during fall and winter, when there's less sunlight. These symptoms usually go away completely when spring and summer arrive. However, about 10% of people with SAD have the opposite pattern, feeling depressed during spring and summer instead. Today, doctors recognize SAD as a serious condition that needs treatment, not just something you have to tough out until spring. About 5% of Americans experience SAD in any given year, which equals around 10 million people. But another 10 to 20% of Americans have milder symptoms that still affect their daily lives. Certain groups are more likely to develop SAD. Women are twice as likely as men to be diagnosed with the condition. The disorder usually starts between the ages of 18 and 30, with the average person developing symptoms around age 23. Where you live makes a huge difference. People who live farther from the equator are at higher risk because they get less sunlight in the winter. In Florida, only 1% of the population has SAD, but in Alaska, it jumps to 10%. Even within northern states, the numbers are striking. New Hampshire sees rates near 10%, while southern states have much lower rates, like here in Arizona. For most people with SAD, symptoms start in late fall, around October or November. The condition typically lasts about 40% of the year, with January and February being the hardest months for most Americans. Symptoms usually lift by the spring or early summer. Timing connects directly to daylight hours. As days get shorter and darker in fall, people begin noticing changes in their mood and energy, especially around daylight savings. By the time winter arrives, symptoms are usually at their worst. Then, as spring brings longer days and more sunlight, people start feeling like themselves again. I used to live in Seattle, and I remember thinking it was the most glorious thing in the summertime. And then the winter would come, and it would be dark and gloomy, and by January and February, everybody was losing their minds. That's at least how I remember it. The early warning signs of SAD are similar to other types of depression, but they show up at the same time every single year. Common symptoms include persistent sadness or feeling down most of the day. You might lose interest in activities you normally enjoy and want to avoid friends and family. Energy problems are huge red flags. Many people with SAD feel exhausted no matter how much they sleep. In fact, oversleeping is very common with winter SAD, with some people sleeping much more than usual. Others have trouble concentrating or making decisions. Appetite changes happen frequently. People with winter SAD often crave carbohydrates and sweets, which can lead to weight gain. One survey found that 20% of people eat more sweets during the winter months, and it's not just because of Thanksgiving and Christmas. You might also experience feelings of hopelessness, worthlessness, or guilt. In severe cases, people have thoughts of death or suicide, which requires immediate medical attention. One key difference between SAD and regular sadness is that these symptoms are serious enough to interfere with your daily life. If you just feel a little blah on cold days, but can still function normally, that's probably the winter blues, not necessarily SAD. The main cause of SAD is reduced exposure to sunlight during fall and winter. Sunlight affects 3 important systems in your body. First, less sunlight disrupts your body's internal clock, called your circadian rhythm. This clock controls when you feel awake and when you feel sleepy. When it gets thrown off, you might feel tired at the wrong times or have trouble sleeping at night. Reduced sunlight decreases serotonin levels in your brain. Serotonin is a chemical that regulates mood and makes you feel good. It's your happy hormone. Lower serotonin levels can trigger depression. To understand serotonin better, check out my video here. Third, changes in light exposure affect melatonin production. Melatonin is the hormone that makes you feel sleepy. During winter, your body might produce too much melatonin, leaving you feeling sluggish and tired all the time. To learn more about melatonin, check out my video here. Some scientists also believe vitamin D plays a role. Your body makes vitamin D when sunlight hits your skin. During winter, with less sun exposure, vitamin D levels just naturally drop. Low vitamin D has been linked to depression, though researchers are still studying this connection. You can check out my video on vitamin D and how it affects your body here. Genetics matters too. If family members have SAD or other types of depression, you're at higher risk of developing the condition yourself. The good news is that SAD responds well to several proven treatments. Light therapy is the first-line treatment for winter SAD. It's not just a wellness trend, it's a real medical treatment backed by decades of scientific research. Light therapy works by fixing the root cause of SAD. When you sit in front of a bright light box producing 10,000 lux, the light travels through your eyes to your brain areas that control mood and sleep cycles. This triggers important changes in your body. It resets your internal clock, fixing the timing problems that cause sleep issues and exhaustion. It allows more mood-boosting serotonin to stay active in your brain. It also reduces excess melatonin, which helps you feel more alert and energetic during the day. For light therapy to work, you need to follow specific guidelines. Use a light box that produces 10,000 lux. which is about 20 times brighter than normal indoor lights. Sit in front of it for 20 to 60 minutes each day, with most people needing about half an hour. Timing matters. Use it within the first hour after waking up for the best results. Place the box at eye level, about 16 to 24 inches from your face. Keep your eyes open, but don't stare directly at it. You can read, eat breakfast, or work while the light shines towards you. Light therapy has many benefits, and most people handle it well. It works relatively fast, with some patients feeling better within days to weeks. There are no drug interactions, so it's safe to use with other treatments. The devices cost between $50 and $300, and I'll link several from Amazon in the description. You need to use it every day, which takes time and commitment. Some people get mild side effects like eye strain, headaches, nausea, or feeling jittery when they first start, but these usually go away within a few days. In my practice, I've seen patients successfully fit light therapy into their morning routines. The secret is just making it part of something you already do, not treating it as a separate chore. Many of my patients put their light box on their breakfast table and use it while eating breakfast and drinking coffee. This way, the 30-minute session doesn't feel like wasted time. They're doing two things at once. One patient keeps her light box on her bathroom counter and uses it while getting ready for work. I tell my patients to start in September or early October before symptoms show up. This prevents SAD from fully developing. They continue daily use through March or April, then slowly stop as natural daylight increases. While light therapy fixes your sleep cycle, good nutrition, especially vitamin D, and healthy eating can give you extra support in managing seasonal affective disorder. Vitamin D is important for SAD because winter reduces your body's natural vitamin D production. Research shows that people with depression, including SAD, have lower vitamin D levels than healthy people. Vitamin D affects mood in several different ways. It helps your brain make serotonin, the feel-good chemical. Vitamin D receptors also exist throughout the brain areas that control emotions, meaning the vitamin directly impacts your mental health. It also reduces inflammation, which may help relieve depression. You can get vitamin D as a supplement, but it's important to track your blood levels. For my patients at risk in the winter, I generally have them take 2,000 international units of vitamin D and track their blood levels regularly to make sure they don't overdose on it. Beyond vitamin D, certain foods can support stable moods during winter. Omega-3 fatty acids from fatty fish like salmon, mackerel, and sardines tremendously help with depression. These healthy fats affect brain cell function, brain chemical release, and inflammation, which is all connected to mood. Research shows that omega-3 supplements, especially EPA, can improve depression symptoms, particularly when combined with antidepressant medications. I tell my patients to eat fatty fish at least twice a week or take a high-quality fish oil supplement with 1 to 2 grams of combined EPA and DHA daily. For vegetarians, algae-based omega-3 supplements work well. Other helpful diet strategies include eating regular meals with enough protein to prevent energy crashes and mood swings, limiting refined carbs and sugar since SAD creates carb cravings that can cause blood sugar problems that worsen mood, drinking plenty of water to support brain function, and eating foods rich in tryptophan like turkey, eggs, cheese, and nuts, which help your body make serotonin. Diet changes shouldn't replace your main treatments, but they add extra support as part of a complete lifestyle plan for managing SAD. To get the best advice on nutrition and how it impacts your overall health, check out Dr. Agne's great YouTube channel on this subject. When light therapy and lifestyle changes aren't enough, or when SAD symptoms are moderate to severe, antidepressant medications provide effective relief. Understanding how these medications work helps you make smart decisions. Bupropion extended release is special. It's the only medication specifically approved by the FDA for preventing seasonal depression. Studies show that starting bupropion in autumn before symptoms appear significantly reduces your risk of getting a full depressive episode. SSRIs, or selective serotonin reuptake inhibitors, are another effective option for treating SAD. SSRIs block the serotonin transporter, preventing serotonin from being reabsorbed after it's released. This increases the amount and duration of serotonin available in your brain, which improves your mood. While serotonin levels rise within hours of taking an SSRI, the mood-boosting effect takes several weeks to develop. This delay suggests SSRIs trigger deeper changes in brain function beyond just increasing serotonin levels. Common SSRIs that we prescribe include Prozac, Zoloft, Celexa, Lexapro, and Paxil. Regular check-ins are essential to monitor how well it's working, adjust the dose if needed, and manage any side effects. Finding the right treatment sometimes requires trial and adjustment. What works for one person may not work for another, and persistence is key to finding an effective solution. Benjamin Franklin said, "An ounce of prevention is worth a pound of cure." There are several proven ways to prevent SAD symptoms from starting in the first place. The most effective prevention strategy is starting light therapy in early fall, before your symptoms typically begin. You can also start taking antidepressant medication before symptom onset. Lifestyle changes make a real difference too. Regular exercise helps relieve stress and anxiety while boosting mood-enhancing chemicals in your brain. Even 30 minutes of walking can help. Getting outside for 5 to 10 minutes of natural sunlight each day, especially in the morning, can boost serotonin levels. Check out my book review on Spark to understand the impacts of daily exercise on every area of your life. Make your indoor environment brighter by opening blinds, trimming tree branches that block windows, or adding skylights. Sit near windows at home and work to get more natural light exposure. Other preventive strategies include maintaining a regular sleep schedule, avoiding oversleeping, eating a balanced diet rich in omega-3 fatty acids, and avoiding excess carbs, staying hydrated, practicing stress management techniques like meditation or yoga, and staying socially connected with friends and family, probably the biggest determinant of your health. If possible, taking a winter vacation to a sunny, warm location like Arizona can provide relief for people with winter SAD. Seasonal affective disorder is a real form of depression that affects millions of Americans every year. It's caused by reduced sunlight exposure during fall and winter, which disrupts brain chemicals in your body's internal clock. The condition follows a very predictable pattern, with symptoms starting in late fall, peaking in January and February, and lifting completely by spring. Warning signs include persistent sadness, oversleeping, low energy, carbohydrate cravings, difficulty concentrating, and loss of interest in activities you normally enjoy. The good news is that SAD is highly treatable. Light therapy using a 10,000 lux light box for 20 to 60 minutes daily helps about half of people deal with it. Antidepressant medications like bupropion and SSRIs address the brain chemical imbalances. Vitamin D supplementation and dietary changes with omega-3 fatty acids provide additional support. You can also prevent SAD by starting treatment in early fall, exercising regularly, and getting outside for natural sunlight, also while maintaining good sleep habits and staying connected with others. Your mental health is too important to leave to chance or just toughing it out every winter. If you notice these symptoms returning every season, the exhaustion, the sadness, the loss of motivation, you don't have to accept it as normal. You're welcome to join my practice at Bespoke Concierge MD. We're here to help nationwide, offering personalized support that includes comprehensive evaluation, evidence-based treatment plans with light therapy, and medication when needed, and one-on-one support throughout the fall and winter months. We treat you as an individual, not a number, because your seasonal pattern and symptoms are unique to you. Whether you're looking to prevent SAD before it starts, finally get relief from symptoms you've dealt with for years, or optimize your health year-round, we're here to guide you every step of the way. From initial assessment to personalized treatment plans to ongoing monitoring and adjustments, we make healthcare simple, science-backed, and sustainable. Thanks for watching. If this information helped you or someone you know, please share this video. Your story in the comments could help others realize they're not alone in their struggle with seasonal depression. Remember, SAD isn't something you have to just endure. It's treatable, and relief is possible when you have the right tools, support, and personalized guidance. Take the first step today, and let's work together to help you feel like yourself again, even during the darkest months of the year.